Addiction, properly understood, is not a disease or genetic, really. What it is, nor is it a free choice that somebody makes. Addiction is a desperate attempt to escape human suffering. And when you ask people, what do you get from your addiction, whether it's pornography or drugs or gambling or, nicotine, caffeine, heroin, what does it give you? They all get something like stress relief, numbing from emotional pain, separation from distress, a sense of control, sense of agency, sense of belonging. All of these things are essential human attributes, and the addicted person just wants to feel like a normal human being. And so my mantra is, don't ask why the addiction, ask why the pain. And if you want to understand why people are in emotional pain that they have to escape from, you have to look at their lives. And if you look at their lives, whether you do it anecdotally or large-scale studies statistically, it's trauma, it's adversity, it's stress, it's emotional pain. Now, if you look at depression, again, the word itself means to push something down. What gets pushed down in are people's emotions, their legitimate anger, for example, and this happens when children are abused or they're just not seen, received, understood, attuned with, valued for who they are. They have to pretend to be somebody else. They have to suppress their emotions in order to be acceptable by their environment. And in a society where the parenting environment itself, due to no fault of the parents, but because of the stresses of society, is becoming more and more volatile, more and more stressed. Families are more and more under conditions of isolation and pressure. Fewer and fewer parents are able to be there for the kids the way they need to be, which means kids have to be pushing down their feelings, which means you're going to see more depression. And if you look at the broad social causes, it's everything that you've often talked about on your program, the rise in inequality. You can trace inequality and the rise in mental health problems in a society. You can trace globalization, increasing isolation, and the rise in ADHD from Germany to Israel to China, the United States. You can trace globalization, inequality, and the rise in obesity and diabetes. And if you look at the social factors that stress people, they are the factors that are generated voluminously in a individualistic, aggressive, capitalistic society, which are loss of control, fear, conflict, uncertainty, and lack of information. And when you put millions of people under such conditions, you're going to see a rise in all manner of pathologies.